My name is Alison Wright. I am a researcher for the Global Psoriasis Atlas based at the University of Manchester and joint first author of this paper looking at the incidence and prevalence of generalized pustular psoriasis in Johor Bahru, Malaysia. GPP is a rare form of psoriasis, which is often misdiagnosed by non-dermatologists due to unfamiliarity with the clinical manifestations of this rare disease. This makes it challenging to estimate the number of people affected by GPP, and there is a global scarcity of studies on the epidemiology of GPP with no data from Southeast Asia. We extracted data from the Malaysian Teleprimary Care clinical information system, which includes data from primary and secondary care facilities between 2010 and 2020, and identified 230 people with a diagnosis of dermatologist-confirmed GPP and around 1.2 million people without any record of psoriasis. We then estimated the annual incidence and prevalence of GPP and assessed differences in rates and age of GPP onset by gender, ethnicity, and presence of associated plaque psoriasis. Flares are a hallmark of GPP, so we also examined the frequency of flare episodes and trigger factors for these flares. During the 11-year study period, the prevalence of GPP was found to be higher in this Malaysian population than previously reported in other countries at 198 per million, with the prevalence increasing modestly between 2010 and 2020. Annual prevalence was consistently higher in women than men, and highest amongst the Chinese population, followed by Indians and Malays. Out of the 230 patients with GPP, 66% also had plaque psoriasis. Men and those of Indian ethnicity were more likely to have GPP with plaque psoriasis, whereas women and Malays were more likely to have GPP alone. Similar to plaque psoriasis, a bimodal trend in age at GPP onset was observed, with first and second peaks at 20 to 29 and 50 to 59 years of age. The onset of GPP was significantly earlier in women than men, in Malays than other ethnic groups, and in those with GPP alone than with those with associated plaque psoriasis. Examining the flare data, 79% of patients had at least one moderate to severe flare, with the majority of flares clustered around the initial years of the GPP diagnosis. Flares were more commonly reported in patients without plaque psoriasis, and the most common factors precipitating a flare were withdrawal of therapy, mainly systemic steroids, infections, which was predominantly upper respiratory tract infections, use of medications, mainly steroids and traditional medicines, and pregnancy. By conducting this first population-based study in Malaysia, we are contributing to the global mapping of GPP, which will help inform the management of this rare condition.